Hi everyone, Jonathan Charbonneau here. I want to spend a bit of time just introducing a new program called McMAP, the McMaster Modular Assessment Program. Don't get hung up on all the jargon there. Essentially, this is a new way for us to assess Royal College Emergency Medicine residents. It'll only be for them. It will not be for medical students. It will not be for off-service residents. Hi everyone, Jonathan Charbonneau here. I want to spend a few minutes of your time introducing McMAP, the McMaster Modular Assessment Program. This is going to be a new way for us to assess emergency medicine residents. Don't get hung up on the jargon. This is not around medical students. This is not around off-service residents. But it's a way for us to improve the quality of education that we provide for our EM trainees. This is something that many of you will be familiar with, and thanks to those on faculty that have helped to contribute to it. But it's also something that we've developed even more than using our local experience and going more broadly to the University of Alberta and to Saskatchewan, and then ensuring that there's good educational design behind it, looking for reviewers from Oregon, Louisiana, and Michigan to provide some validity to what we're trying to do. So essentially what we currently have is kind of some mishmash of daily eval cards for medical students and then ITERs for our residents. And all of us understand that these are really particularly frustrating. Oftentimes we look at it and say, I'm not sure how to evaluate someone using this card. The criteria are not clear, or it's such far removed from when we evaluate our residents. The ITER, for example, is something that most of us will fulfill out weeks to sometimes, unfortunately, months after we've seen them. And so our residents who are desperate to get helpful, insightful feedback that will allow them to get better on their next shift are stuck looking at kind of generic, nice comments that say, yeah, you're a pretty nice person, you're kind of doing okay, and they receive it months later, and so they're left floundering. It should be clear that the purpose of this new assessment program is not for us to be able to weed out people that we think are not doing well. In fact, our statistics would tell us that they are very, very much in the minority. Rather, this attempts to take all the paperwork and all the time that we used to waste and be much more efficient and proficient in providing a better educational experience for our residents who are in our program. They're excellent residents, and our goal is to use all that time you used to spend filling out ITERs, get rid of all of that, and reinvest this in filling out an assessment program that will give them feedback, allow them to get better day by day. You recall that in the fall of late last year, we did a very comprehensive needs assessment. I'm going to save you the time by going through all of that data and point out two kind of really important themes. If we were going to change it, it needs to be very efficient and fast. We're all pragmatically minded. I will tell you up front that this will add anywhere from 2 to 5 minutes to your clinical day for the resident that you're evaluating. But we believe as a teaching hospital that investment will provide a good return on investment and that it's appropriate for us to do that. We also heard loud and clear from you that you wanted clear objectives. Rather than being given something vague, you wanted to be given advice on here's the task to look at, here are the criteria or the milestones or the standards that the resident should be evaluated on, and here is the process by which we do it. And that's what we've attempted to develop. The residents say they want immediate feedback, and all of us, I think, perhaps one of the reasons we're drawing to working in a teaching hospital is that we want to coach, we want to teach our future colleagues so they can become excellent clinicians in emergency medicine. So, essentially how it works is every day you're going to be given a specific small chunk of what it means to be an emergency clinician to look at and to watch what your resident does. So on this day, for example, it might be you're directed to look at how a resident charts. Now they're going to go off and do all the other things they always do, and you're going to know about it as much as you always know about it. But in particular, you're going to need to pay attention to 3 of their charts. And then we'll provide the framework, and we'll provide the paperwork, and we'll provide the standards and the criterion by which you're going to provide feedback and document what you probably are already doing, but in a rigorous and formalized way, how a resident is charting. And on the second day, it might be how they take a history, and on the third day, it might be how they perform a common procedure, and on the fourth day, it might be how they give a consult, etc., etc., etc. But you're going to have a small little task that day that you actually have to pay attention to and be prepared to assess the resident on. And that's going to be the basis for the bulk of what you're going to need to do. And that's going to be that 2 to 5 minutes that you're going to be spending that day that's new. Now, certainly we want to get your feedback on how the resident is doing overall in terms of their medical expertise. We don't want to say, well, you're a great charter, but you have no idea how to look after a patient with chest pain. That's not what we're trying to say. So the other part is, based on some more tight criterion standards, we're also going to ask you that at the end of the day, give us a general sense of, based on today, how is the resident performing as an emergency medicine resident? And it's not a global thing, but we will actually give you specific criteria for a PGY 1, for a PGY 2, etc., etc., etc. We have a third task that you will probably use in very exceptional, i.e. rare moments. Those will be the moments where something really well has been performed, or there is a matter of concern. And these exceptional events will be cards that we placed into a lockbox. And certainly we would welcome you discussing it with the resident, but it would not be required. And these will be actions that need to be flagged either for praise or for potential remediation with the resident via the CTU director, the program director, etc. Now, you might be saying, wow, what kind of slipshod program are you guys running here? You don't need to understand the wiring or the template or the foundation upon which it builds. We only ask that you spend that 2 to 5 minutes looking at a very explicit, discrete task and filling out the very quick paperwork that will guide you in giving good feedback to your resident, but also in progressing them from being competent to expert clinicians. Just so you don't feel worried about it, all of these little tiny snapshots we put together into a very reliable framework that makes sure that they're sampled multiple times, that they overlap, and all the things that are required to be a good emergency clinician are captured. So this is going to be piloted starting October, and I'll be meeting with all of the clinician groups at HHS and St. Joe's to again discuss this in person. So if there are questions that come up, I'd really welcome you to bring them forward to me, or if you want to speak to me in private or personally, please do so. You can reach me at via email at sherbino@mcmaster.ca. So let's just go over what's required of you. Every day the resident's going to come up to you and give you their book. This is being driven by them. You don't need to worry about it. You just need to respond to their request. And they're going to say, today we need to do this task. And they're going to show you what the task is and then give you the framework and the criteria. And so you're going to need to plan your day, that if you need to watch a resident provide discharge instructions to a patient, that you're there at least once to watch that happen. And you need to plan your day. If you need to look at 3 of their charts, you better make sure that you look at 3 of their charts that day. Then at the end of the shift, you'll fill out the documentation. You'll kind of give an overall wrap-up of how things went that day. And if something exceptional or an outlying event happened that day, you may want to consider filling out the exceptional events card and putting it in a lockbox. It may occur quite frequently that this is not something that you do. Now, we understand that with all pilots there's always wrinkles. We've done our best to anticipate them and to make this as seamless and as painless a process for you. It will require an extra 5 minutes of your time. And I understand the challenge that we all face, but we believe that this 5 minutes will be well used and will increase the proficiency and the excellence that have become known and have defined our residency program. We really want to hear the feedbacks from you. We're not going to tweak it endlessly. We will batch all of the changes probably on a 3-month cycle so that we can make this improve and work forward. So thanks very much for your time. Please give me a shout if you want to talk to me more in person. That's sherbino@mcmaster.ca. Thanks.